Chapter 1 covers athletic training and allied health profession. A certified athletic trainer must be in good standing with the Board of Certification, or BOC, and in most states hold a state license to legally practice as an athletic trainer. Yet despite these requirements, when faced with the question of, "What do you do for a living?" the response of, "I'm a certified athletic trainer," is often met with a quizzical, "What's that?" This can be bothersome. However, rather than be amazed that people know nothing about the profession, it is best to take the time to educate them. Athletic training is a fairly new profession, and the name of the profession can be confusing for those who do not understand it. If faced with, "What's that?" students and professionals need to be able to tell people exactly what an athletic trainer does, with whom athletic trainers work, and what it takes to become an athletic trainer. Athletic training is a healthcare profession. Stop reading. Close your eyes and repeat that over and over in your head for about 10 seconds. Did you do it? I cannot stress this point enough. Athletic training is a healthcare profession practiced by highly specialized clinicians. Athletic trainers make complex clinical patient care decisions, respond to catastrophic emergencies, provide immediate care, develop and execute therapeutic interventions, and work as trusted colleagues in a variety of healthcare settings. One of the most confusing issues regarding the name is the confusion with personal trainers. The National Athletic Trainers Association, or NATA, has gone to great lengths to educate the public about the difference between these two professions. As previously mentioned, athletic training is a healthcare profession, whereas personal fitness trainer prescribes, monitors, and changes an individual's specific exercise program in fitness or in a sports setting. Athletic trainers are referred to by their name, athletic trainer, not trainers. Trainers refer to a personal fitness trainer, not an athletic trainer. To become an athletic trainer, there are certain criteria one must possess. They must have at least a bachelor's degree, but will need a master's degree by the year 2026, pass the Board of Certification or BOC exam, keep knowledge and skills by participating in continuing education, and adhere to the standards of professional practice set by one national certifying agency. The NATA is a professional membership association for athletic trainers and others who support the athletic training profession. Founded in 1950, the NATA has grown to more than 43,000 members worldwide today. A more detailed history of the athletic training profession will be covered in Chapter 2. The NATA's mission is to represent, engage, and foster the continued growth and development of the athletic training profession. A link to the NATA website is provided. Please feel free to browse the site at your leisure to help you get a feel for what the NATA is about and the resources it provides to its members. While being a member of the NATA is not required, certification can be maintained with the BOC without paying NATA dues. The majority of athletic trainers choose to be members of the NATA to support their profession and to receive a broad array of membership benefits. The benefits provided by the NATA can be found on the link to the first website. Proper terminology that athletic trainers should use when discussing the athletic training profession or using credentials are provided by the second website. The need to increase the amount of original research in the profession was directly addressed by the formation of the National Athletic Trainers Association Research and Education Foundation, or NATA-REF, in 1991. The foundation was established by grants from the NATA and the Johnson & Johnson Corporation. The primary aim of the foundation is to encourage scientific research among professionals who focus on improving the health care of the physically active population. The NATA Foundation has made a tremendous impact on building a research culture in athletic training. Since its inception, The NATA Foundation has awarded more than 260 research grants totaling more than $4 million and has awarded almost $3 million to nearly 1,500 students through the scholarship program. The BOC has been responsible for the certification of athletic trainers since 1969. A link to the BOC website is provided. Upon its inception, the BOC was an entity of the NATA. The mission of the BOC is to provide exceptional credentialing programs for healthcare professionals to assure protection of the public. The BOC provides a certification program for the entry-level athletic trainer and establishes requirements for maintaining the status of a BOC athletic trainer. To become a certified athletic trainer, athletic training students must pass a comprehensive exam administered by the BOC. The certification process assures that entry-level professionals have met a standard of minimum competency. Only those who pass can call themselves certified athletic trainers and use the ATC credential. An athletic trainer must pass a comprehensive examination administered by the BOC. The certification exam is composed of multiple choice as well as hybrid style questions. The BOC exam assesses a candidate's knowledge of athletic training within the framework of the 5 domains of athletic training as defined by the Role Delineation Study and Practice Analysis, which is a survey of entry-level athletic trainers' professional duties and responsibilities. The results define the content areas and skills needed in the practice of athletic training. This study provides the framework for the certification exam. The 5 domains of athletic training identified in the Role Delineation Study are as follows: injury, illness prevention, and wellness protection, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, and organization and professional health and well-being. As previously stated, the certification process assures that entry-level professionals have met a standard of minimum competency. Only those who pass can call themselves certified athletic trainers and use the ATC designation. The purpose of the Commission on Accreditation of Athletic Training Education, or CAATE, is to develop, maintain, and promote appropriate minimal educational standards of quality athletic training programs. CAATE accredits professional, post-professional, and residency programs in athletic training. It also creates standards and guidelines referred to as the standards used to prepare athletic trainers for each type of accredited program. These standards are used for the development, evaluation, analysis, and maintenance of athletic training programs. Each institution is responsible for demonstrating CAATE compliance with the standards through comprehensive and annual review processes to obtain and maintain recognition as a CAATE-accredited athletic training program. Athletic training is an allied health profession. In June 1990, the American Medical Association, or AMA, officially recognized athletic training as an allied health profession, with its formal organized origins in the 1950s. The AMA recognition was a historic achievement for the profession. Characteristics of an athletic training as a profession include the following: expertise in a body of knowledge and skills, trusteeship as guardians of this knowledge for society, professional training and certification, adherence to an ethical code of conduct, and service and value of performance above reward. Copies of the BOC Standards of Professional Practice that encompass these characteristics are provided in the appendices A and B in your textbook, as well as on the NATA Code of Ethics link on this slide. Athletic trainers can be found in a variety of employment settings that will require them to provide health care particular to the needs of the patients in that setting. One constant for athletic trainers in all settings is the guidance provided by physicians. Athletic trainers, like other allied health professionals, work under the direction of a licensed physician. Practice domains for the athletic trainer cross all employment boundaries, outline the general roles and responsibilities the athletic trainer fulfills as a healthcare provider, and are reflective of the scope of the athletic trainer's duties. Each domain outlined on this slide and the next few slides have been identified from the Role Delineation Study and Practice Analysis. The first domain is injury, illness prevention, and wellness protection, which is appropriate that it falls at the top of the list since a large portion of what athletic trainers do fall into the realm of prevention and risk management. As frontline healthcare providers, prevention and risk management can take several forms. Communicating and educating patients, parents, administrators, coaches, and other healthcare providers about the risk associated with activity are key components of prevention. Athletic trainers must understand the pre-participation screening process to help identify the conditions that place participants at risk. They must also be able to implement a number of prevention strategies, such as being able to fit and use protective equipment, develop and apply taping and bracing techniques, design and implement conditioning programs, and promote nutritional practices to help maintain a healthy lifestyle. The second domain is where the athletic trainer must possess the ability to recognize, evaluate, and diagnose injury and illnesses. These clinical skills allow the practitioner to fulfill a variety of essential functions. A practicing athletic trainer must be asked to perform several different types of evaluations, including but not limited to pre-participation examinations, which is to determine the readiness of an individual to participate in physical activities, an on-field examination for acute conditions that occur during activity using the primary and secondary survey methods, the comprehensive clinical evaluation, which often occurs in a clinical or athletic training facility, and an ongoing evaluation of progress of an injury or illness, assisting the athletic trainer in advancing or modifying current care and making return to play decisions. Domain 3 is very unique to the athletic training profession, as an athletic trainer may be present at the time of an injury or emergency. The immediate care of injuries requires the athletic trainer to be able to quickly and calmly activate an established emergency action plan, initiate life-saving procedures like CPR, use appropriate emergency equipment, and communicate effectively with others in emergency situations. The athletic trainer must be prepared to take a leadership role in an emergency or act as a member of a response team in carrying out an emergency action plan, or EAP. To succeed, the athletic trainer must demonstrate excellent communication skills, both verbal and written, in order to transfer vital assessment information to the healthcare provider, parent, supervisors, and others that are involved in the healthcare of the individual. Additionally, the athletic trainer must have a vast knowledge of medical conditions that can quickly become emergencies and select the most effective and safest method to transport the individual to appropriate healthcare facility or professional. The fourth domain allows athletic trainers to use their skills and knowledge to determine the best course of treatment for specific injuries and illnesses. The athletic trainer, working under the directions of a physician, must design, administer, and execute a plan of care for various injuries and illnesses. Athletic trainers carry out these plans by using appropriate therapeutic techniques that are designed to provide the best possible patient outcomes. Therapeutic exercise and other interventions are selected in the interest of facilitating the patient's recovery and return to function. Key to success in this treatment in rehabilitation domain is the athletic trainer's ability to do the following: protect patients from additional injury while providing steps towards optimal recovery through the use of short and long-term goals, achieve goals by using appropriate treatment rehabilitation methods, and the selection of various treatment rehabilitation methods must be based on sound rationale, appropriate standards of healthcare, reliable clinical judgment, and when available, evidence-based medicine. In order to properly implement any type of comprehensive athletic training services, an organization must demonstrate and support an appropriate level of organizational and professional health and well-being, which is the fifth domain. Organizational and professional health and well-being is defined as an organization's ability to function effectively, to cope adequately to change appropriately, and to grow from within. While many organizations differ, the athletic trainer's role is often similar in many sports medicine settings. Athletic trainers must interact with a wide variety of individuals, organizations, and healthcare personnel in providing care for patients. They are often thought of as gatekeepers, whose roles include managing information, developing procedures, understanding insurance guidelines, communicating effectively, adhering to state regulations, and maintaining medical records. Additionally, an athletic trainer must be a must be dedicated to improving his or her knowledge over the course of his or her career by meeting continuing education or CE requirements put forth by the BOC. Once a student becomes a certified athletic trainer, he or she must meet specific continuing education or CE requirements set forth by the BOC in order to maintain his or her credential. CE requirements are intended to promote continued competence, development of current knowledge and skills, and enhancement of professional skills and judgment. CE activities must focus on increasing knowledge, skills, and abilities related to the practice of athletic training. Athletic trainers must complete the following to maintain their certification. They are required to comply with the BOC Standards of Professional Practice, which consists of the Practice Standards and the Code of Professional Responsibility. They must maintain ongoing ECC certification at the basic life support or professional rescuer level or beyond, pay an annual certification maintenance fee, and complete 50 CEUs in a 2-year period, 10 of which must be designated as Evidence-Based Practice or EBP CEUs. For a list of all of the CE requirements, please see the Requirements to Maintain BOC Certification in Athletic Training on pages 11 through 13 of your textbook and the following link on the BOC website. Athletic trainers can be found in a range of employment settings. While the profession has its origins in the intercollegiate setting, the past 30 years have seen tremendous growth into all areas of healthcare where patients can benefit from the unique skills athletic trainers offer. A list of different employment settings are provided on this slide. As the profession continues to evolve, so will the settings athletic trainers can find gainful employment in. The profession of athletic training may have originated in settings that focused on team sports and educational settings, yet recent data has demonstrated that this has changed. As of the publication of this textbook, almost half of all certified members of the NATA work in the university, college, junior college, or high school settings. This means that over half of athletic trainers are employed in clinic, hospital, industrial occupational, military, public safety, or private settings. The next generation of athletic trainers will need to be prepared to work in settings outside of the traditional athletic environment. The growing acceptance and understanding of physical activity as a cornerstone to a healthy lifestyle places the athletic trainer in a position to provide expertise to a larger segment of the healthcare community. What will be the next employment setting to benefit from the expertise of an athletic trainer? Providing practitioners practice within the boundaries of their state regulation, the possibilities are endless. Growing numbers of athletic trainers can currently be found working in the arts and in areas of music and dance. Athletic trainers have also provided care and technical information to performers in many environments, including television and motion pictures. Wherever people can benefit from a skilled and versatile healthcare practitioner, there is promise for an athletic trainer. The completion of the certification exam alone does not fully define the right to practice athletic training. The regulation of the practice of any allied health profession is the responsibility of the state. Currently, 49 states and the District of Columbia regulate the practice of athletic training. The link provided from the BOC has more information on the state regulation of athletic training. The purpose of regulation is twofold. It is designed to protect the public by ensuring that professionals who practice athletic training have met a minimum level of preparation. Regulation also protects the profession by ensuring that only properly trained and credentialed practitioners may use the title of athletic trainer. There are 4 forms of regulation for the athletic training profession: licensure, certification, registration, and exemption. States that license athletic training have established regulation that defines the scope of professional practice for athletic trainers. These laws, overseen by the State Licensing Board, prohibit the practice of athletic training by individuals who do not hold a license. New Jersey, Pennsylvania, Delaware, and Maryland are all states nearby that require licensure to practice athletic training. Certification is a form of title protection that certifies that an athletic trainer has met basic requirements to perform the duties of an athletic trainer. Certification laws are considered less stringent than licensure and that they only protect the title and minimum requirements to hold a credential. They do not help define the duties that can be carried out in the practice of the profession. New York and South Carolina are the only states requiring certification. Registration laws require that qualified athletic trainers register with the state in order to practice athletic training. The registration is a form of title protection. Only qualified professionals may register, call themselves athletic trainers, and therefore practice in that state. Hawaii is the only state that has registration. Exemption laws allow athletic trainers to practice the profession without violating the Practice Act of other medical and health professions. These laws are designed to prevent conflict with existing practice acts of physicians, physical therapists, physician assistants, and other allied health professionals. Currently, California is the only state that falls into exemption status. Athletic training, like any profession, faces many challenges as it grows and moves forward. There are issues unique to individual work settings that center on hours, salary, and working relationships. There are broader questions that are of concern to the profession as a whole. These include, but are not limited to, reimbursement for services, regulation and licensure, education reform, and the athletic trainer's scope of practice. Students can make better decisions regarding their course of study and their career goals by understanding these issues. Athletic training demands a high level of patient interaction, large demands of time, and an emotional investment in patient welfare. Some athletic training settings have the added stress of non-traditional work schedules, long hours, travel, multiple role demand, and little control over work schedules. These job stressors, particularly in the intercollegiate setting, have been historically associated with the phenomenon of burnout and more recently with work-family conflict and quality of life. Additional research is needed to better understand these important athletic training work setting issues. No matter the work environment, the athletic training professional who can achieve a healthy balance between caring for others and caring for him or herself and his or her loved ones will be well positioned for higher levels of job satisfaction and an enhanced quality of life. In summary, athletic training is a rewarding allied health career that can be practiced in a wide variety of employment settings. Students who understand the full scope of the athletic training profession will be better prepared to make choices regarding their course of study and career goals.